Hey everyone, I'm Shannon Gonter. I'm a professional counselor here in Louisville, Kentucky, and welcome to our Ask Anything series. These are questions that have been submitted by you guys and that we're taking in and we're getting answered by mental health and wellness experts in the field. And today we have Miss Stephanie Barnes with us. She's a certified social worker. She works at Wellsprings Wellness, LLC in Somerset, Kentucky. She does individual, couples, and family counseling sessions and has a really special passion for working with individuals who have experienced trauma in their past. She sees individuals online via secure HIPAA compliant platform or in the office in Pulaski and in its surrounding counties. So if you want to learn more about her, want to see what she's all about, get some good mental health tips and tricks, follow her on Facebook. It's just her name, Stephanie Barnes, and that's BARNES, CSW. But thank you, Stephanie, for being with us today. We got a good question for you today. So the question that we have for you is there one thing that people could be doing to make themselves a little bit more mentally healthy without actually going to therapy and seeing a therapist?
Yeah, that is a good question. Like most things in mental health, there's not just one simple solution. There's not a quick fix. And there are a lot of factors that need to be taken into account because each individual, has different needs, has different things contributing to those needs, like their environment, family of origin, all that stuff. But we don't have time to go into all of that. So I'm just going to give really my best opinion as a clinician based on what I've learned and what I've seen working with my clients. So quick disclaimer, this is not substitute any treatment for mental health issues. If someone is experiencing mental health issues, they should please seek professional help, speaking a therapist or a doctor or however you feel comfortable. But from my experience, getting enough sleep, getting regular sleep, and getting quality sleep is probably one thing a person could do to improve their overall mental health besides going to therapy.
Yeah, so, I love that you say quality sleep because that's so important. Not just enough sleep, like good sleep.
Yes. Because if you're not getting through all those stages of sleep that we need, the first stage of sleep, the quiet sleep, I believe that's what they call it, and then REM sleep.
Yeah.
And if you're not cycling through all of that, you're not getting all of the benefits of sleep.
Mm-hmm.
And so it plays such an important and complex role in people's lives. Scientists who have studied sleep have found that sleep plays a crucial role in memory, both long-term and short-term. And so they kind of describe sleep as the key to helping us learn and commit things to memory.
Oh, sure.
Sleep is important also for emotion regulation. So if you've ever not gotten enough sleep and been like cranky or irritable the next day, that's why. Sleep also helps with social interactions. So they've done studies and they found that people who were sleep deprived had a harder time reading other people's facial expressions and picking up on social cues. And I imagine that could lead to a lot of awkward situations. And so while sleep requirements vary from person to person, most healthy adults need between 7 to 9 hours of sleep per function at their best. And I know that kind of sounds like a lot. I don't think most people get that much sleep, but that's really what we need.
Yeah.
Children and teens need even more. So that's why your teenager is sleeping all the time. They need a significant amount more of sleep. And then as you get older, you don't need as much, but you need a minimum of 7. So really nobody should be getting less than 7 hours of sleep a night. And, most Americans are not getting enough sleep. So that's a real issue. They found that chronic sleep problems affect 50 to 80% of patients in a typical psychiatric practice
Mm,
compared to 10 to 18% of the general US population. So it really shows that sleep issues are very highly correlated with mental health issues.
yeah.
Um, they believe that sleep problems are not only maybe the cause of some mental health issues, but also a result of mental health issues. And they see them in patients with anxiety, depression, bipolar disorder, and attention deficit hyperactivity disorder, so ADHD.
Yeah.
Um, and so not getting enough sleep, not getting quality sleep can increase any mental health symptoms that you're already experiencing and can just exacerbate those and make those worse.
Yeah, I was gonna say, like you were saying before, like whether you're in a haze or you're not able to read the cues as well, like it's just gonna exacerbate whatever it may be
Hmm.
going on.
Yeah, all problems really. If you don't get a good night's sleep, you feel it the next day, and people are working and caring for their families and trying to take care of themselves and making complicated decisions, while not having enough sleep. And so that's a real issue, especially for Americans.
Yeah.
And so some common treatments for sleep issues are like sleeping pills and medications, but those can be helpful, but they also come with a lot of side effects, and they should be monitored by a physician because they can be addictive, some of
Yeah.
them. Um, and then, so people with like obstructive sleep apnea, which is where you stop breathing in your sleep, they're often treated with a CPAP machine, and that works by blowing air into the throat via a mask that you wear while you sleep, just
Hmm.
like right here. And that increases the air pressure in the throat and prevents the airway from narrowing and obstructing your breathing. So if you have sleep apnea, or if you've been diagnosed with sleep apnea and you are given a CPAP machine to wear, probably really important that you do wear that, because you are not getting quality sleep if you have sleep apnea.
Yeah.
Um,
Well, and that's a great point to make because sometimes people don't know they have that. And so if you're always waking up tired, if you're getting that 9 hours, but you're always waking up tired, like
yes.
maybe, yeah, maybe you have sleep apnea. Like go to a medical
You,
professional and see what's going on
mhm.
because yeah, that if you're like, I'm getting my 9 hours, but I'm still exhausted all the time, it's like, well, yeah, you're probably not really sleeping, and it can be very dangerous if you don't treat that. So yeah, always seeking a medical professional's advice, of course, is warranted in those situations.
Yes, absolutely. And it is, you're right, it's very dangerous, because you could stop breathing, and then not start at any time, depending on the severity. But also, sleep issues affect your physical health as well. So, they've linked not getting enough sleep or having sleep issues with like diabetes, heart disease, and heart attacks, things like that. So it can be a big factor in a lot of health problems that people are having, mental and physical.
Sure.
So yeah, if your doctor is treating you for sleep issues in any way, be honest with them about how you're sleeping, what time you go to sleep, um, how you feel when you wake up. Get a sleep study if you're able to, if your doctor recommends that, and let them monitor any medications that they give you for sleep. You really just need a physician or a therapist or somebody sort of helping you with that if you're having a lot of issues with sleep.
Mhm.
But if it's just sort of like, well, maybe I could just do better getting some better sleep, you don't feel like it's a huge issue, but you would like to just be a little bit healthier about it, and reap the benefits of that, there are some tips.
They
These
should.
are just a few. Yeah,
We
yeah,
all need the tips.
yes. There's a lot of tips, and I really recommend people like researching this and looking it up. You can find tons of stuff on YouTube about it. But some of the most popular ones that sort of everyone that I was listening to talking about it was saying is staying on a regular sleep schedule is like number one.
Oh, yeah.
So whether it's weekdays, weekends, holidays, over the summer, you're on vacation, whatever, it's really important that you go to bed at the same time every night and wake up at the same time every morning, and kind of build your schedule around that sleep schedule, because um, having that habit gets your body conditioned into that, and then you'll improve your quantity and quality of sleep. Um, Also, sleeping in a cool room is recommended. So they suggest 65 degrees Fahrenheit, around there is like the perfect temperature to sleep in, which sounds kind of cold,
Mhm.
but that really helps because your body has to get to, it has to lower its temperature in order to fall asleep and get into a deep sleep. So a cool room is going to make it easier for you to fall asleep and stay asleep.
Okay.
And then, so let's say you're doing all of that, you're going to bed at the same time, you're waking up at the same time, your room is cool, you're getting ready to go to bed, and you're laying there and you just can't sleep, which happens to everyone. Like, no matter what you do, you're just wide awake. Um, they suggest that just get up, get out of bed, go into a different room and do something else.
Hmm.
And then whenever you do start to feel tired, then go back into your room and lay down and try to go to sleep. And so that way, your body and your brain is associating being asleep, feeling tired, the whole act of sleep, with being in your room and in your bed, and is associating being awake with other parts of the house. You don't want your body to associate being awake while you're in your bedroom, because that's going to be counterintuitive.
Yeah.
Um, so, like, don't freak out about it if you can't sleep. Don't lay there for 2 hours and torture yourself. Like, it's okay to get up and do something and then go back, and you'll eventually train yourself.
Hmm.
And then it'll just be easier to fall asleep in the future.
Yeah.
So those are just a few tips. There's a lot more, but I really think from what I see with clients that I work with, they all have sleep issues of some sort.
Hmm.
And when they are able to improve their sleep habits and get better sleep, they see a reduction in mental health symptoms that really helps their quality of life. So if somebody just wants to practice general mental health, then that is probably one of the best places to start, is with sleep.
Yeah. Yeah. I love that all. And like, it just recharges our body and our brains and mental health and like they're all one thing. We like to
Yes.
separate them out a lot of the time. So like this tips and all those tricks like really help bring it all back together. That if we don't care
Mm-hmm.
for our body and like the basic ways of like getting enough sleep and hygiene and things like that, like yeah, there's no way our mental health has a fighting chance. And so we've got to tie it all in.
Yes,
I love that.
absolutely.
Anything else you want to leave our audience with today? I don't know.
No, just
Yeah,
hope everybody sleeps well tonight. Like,
me too.
and don't get too caught up in it. So the other thing I guess I sort of forgot to mention is sometimes people have problems sleeping because they get anxious about the fact that they can't go to sleep.
Yes.
And so try to really be mindful of that, and don't put too much pressure on yourself. Because if you don't have a great sleep schedule right now, you can train yourself, and there are things you can do to help with that. And it's not going to fix itself overnight,
Yeah.
but don't put too much pressure on yourself. Practice all good coping skills that you have learned, hopefully by going to therapy, or um, listening to your friends that go to therapy. um, and try to relax as much as you can. If you can't sleep, get up, do something else, and go back to bed when you're
Yeah.
ready.
Oh, I love that. Well, thank you, Stephanie. Guys, remember you can check her out on Facebook. It's her first and last name, Stephanie Barnes, comma CSW. Just type it in Facebook. She's got tons of mental health tips and tricks on there. And then if you guys have a question that you want us to answer, or to have a mental health expert or wellness expert answer, just DM us and we'll get that answered for you. But until then and next time, see you later. And thanks, Stephanie.
Thank you. Bye.